All right, good morning, everyone. This is the September meeting of the Queens Borough Cabinet. We have some very timely guest speakers today, especially in light of the ongoing pandemic, among many, many other issues at the moment. Um, Before we begin, I just want to remind everyone that we have, I think, a little under 2 weeks left in the census count, my2020census.gov. If you will kindly remind your constituents and your full board and continue to get the word out, the borough would be grateful. Also, we have our 8th installation of our virtual jobs recruitment fair tomorrow at 2 p.m. And we've been doing this since the beginning of the pandemic, every 3 weeks. So tomorrow will be our 8th installation of that. And if you can help get the word out on that, that would be very helpful. We do intend to have one 3 weeks from now as well. And if you know of any employers in your district, particularly in Queens, who are hiring, we would love to feature them as employers and recruiters. We typically get several hundred attendees who log in for these job fairs. So we appreciate your potential partnership on that. So let's move right along. First up, we've got the Department for the Aging joining us this morning. As we all know, Queens has nearly a third of the city of New York's elder population, and we have the fastest growing elder population in the city of New York. They are a significant part of the borough's constituency. Um, and there's been concerted efforts to make sure that our elders are not left behind, in particular with the pandemic and their extra vulnerabilities to the virus, but also with regard to food insecurity and other elements of precarious livelihoods because of the pandemic. As folks know, the fiscal 21 budget that was adopted a few months ago was very unfortunate with regard to senior services. The borough president's DFTA funding was decimated in wholesale fashion, a little over $1 million, a little over $300,000 of that here in Queens. Hadn't been done in recent memory, but it was some form of a reflection of our fiscal realities. And so the challenge is greater than ever in terms of, or greater than in recent memory, in continuing to serve our elders and making sure that they're not left behind and that they're not abandoned. So today we have joining us from DFTA, we have Associate Commissioner for Social Services and Direct Services. As we know, DFTA works to help ensure the dignity and the quality of life for our elders. They have a number of services, again, very challenging given our dire financial and economic outlook. But with us this morning, we have Jocelyn Groden. Ms. Groden, welcome. The floor is yours.
Thank you. Thank you, everyone. Good morning. Thank you for having me join today for this important conversation around services and impact of COVID-19 on older adults in New York City, in particular in Queens. Really appreciate the time to be here. And happy, to use this opportunity to learn from each other and talk about how we can continue to work together to better support older adults in our city. During this crisis, our mission has remained steadfast to ensure the health and safety of older adults, putting things like food provision and social isolation at the top of our many priorities. As mentioned, we do have a pretty amazing amount of services that we provide to older adults, both directly and through our community partners, many of whom are in Queens, to provide a number of specialized supports and needs. Um, in general, and particularly during the pandemic. One of the things I'm so proud about for DFTA, even though we're a relatively small city agency, certainly compared to others, when things became really clear in March that we were going to be staying home, that older adults needed to stay home, we were able to rapidly pivot almost all of our services to modalities that were accessible to older adults, which include virtual and telephonic. And I can talk in a little more detail about that. I'm sure everyone on this call knows, most significantly in March, we had to close our senior centers due to the public health implications for older adults, and pivoted over a course of a few weeks to a direct to home delivery system serving over 40,000 older adults and more than 1.2 million meals, pretty remarkable during this period. We also, DFTA went from serving 24,000 meals a day roughly to 44,000, a 75% increase from daily senior center participation, including managing, some of the complexities to pivoting to a congregate to direct to home model. When we transitioned DFTA to Get to Food, the citywide emergency food distribution, which has the capacity to serve many adults who were previously enrolled in senior centers, and expanded. We also worked very closely with Get Food and our network of senior center partners to really have them as key pieces of this work, and including them in this authorized enroller function to help register senior center and non-senior center attendees to receive these direct to home meals. We also work with DFTA to transition our wide array of specialized social services. We have a very large focus on social engagement, which I'll talk more fully about as we go on, as well as friendly visiting, and the wide array of super creative and expansive programming that our senior centers provide, whether it's physical, things like Tai Chi or Zumba, intellectual. I mean, some of the topics in classes are pretty extraordinary, and creative, things like painting and drawing from your home. We also have playwriting groups, magic shows, again, the creativity and dexterity of our system to work with staff and older adults to really ramp up and utilize this technology that was new for many of us, certainly including me. It is incredible what has been accomplished, including moving geriatric mental health, caregiver support, case management, and our high cap health insurance webinars, among other services. Even before the pandemic began, under our commissioner, combating social isolation has been a key focal point of DFTA's work. And during COVID, we recognized the need not only to really expand our outreach and approach, but also to really join closely and partner with our sister city agencies, including NYCHA and others in this mission and work. DFTA uses multiple venues to keep older adults connected and to do everything we can to address potential feelings of isolation, which includes a tablet distribution, wellness check-ins, regular calls, From March till about last week, we've made almost 1.4 million check-in calls, which include a combination, about 20% of them are full wellness assessment screenings, which look at older adult needs and the opportunity to connect people to vital resources, most notably food, but also things like direct-to-home medication delivery, medical supply delivery, and other mental health services, elder abuse and safety. We've seen a very large increase in understanding and identification of elder abuse through this work and through our closer connection and conversations with our city partners. We're making about 50,000 calls a week, primarily through our senior centers and case management, although we all share pieces of this work, including many direct DFTA staff. We have an essential purpose, not only to connect older adults with services, but to make sure that they adjust to the realities of this difficult and often frightening environment where older adults have been some of the most impacted. As part of this work, I think you're all familiar with our Friendly Visiting program, which has really expanded as a result of our social isolation public campaign with the Broadway Hamilton star Lin-Manuel Miranda on our PSA, garnered hundreds of volunteer support who wanted to connect with older adults. We at DFTA are also looking right now at opportunities to expand this program, which has traditionally been focused on services to homebound older adults. And now recognizing the universe of homebound older adults obviously has increased exponentially. We're really looking at rolling out new models to reach more people who don't fit that more traditional homebound framework. The reaction from New York has been incredible in terms of, again, the creativity and partnership of our city partners, and how everyone's leaned into this as a moment to address tech gaps with older adults. I think there are a lot of stereotypes that older adults don't have technology, they don't know how to use technology. We've really addressed a lot of that in partnership with NYCHA, distributing 10,000 tablets, connecting people who didn't previously have Wi-Fi access with Wi-Fi, most notably public housing residents, and partnering with OATS to really ramp up training capacity and help desk support for older adults, and seeing how effective, when we give people the support they need, people are to really taking advantage of this technology, which I think has more power in a lot of ways than it ever has before. We are mindful of the impact of the crisis also on the labor market. I think some of you might be familiar. We have a direct unit that looks at senior employment services. It was wonderful to hear you speak earlier about your attention to employment and workforce development. And we continue to pursue the goal, of course, of fostering independence and creating choices for older adults that promote opportunity to leverage their leadership, knowledge, and skills, and really provide meaningful opportunities to be connected and engaged with volunteering, intergenerational opportunities, and recognizing the great, tremendous resource that older adults are in our community. And things we're thinking about right now in terms of next steps are how to develop an anti-aging media campaign to remind older adults of the power and wisdom and opportunity to connect with older adults. Thank you. Thank you for having me.
Borough President, you're still muted, unfortunately.
Any questions from the Borough Cabinet?
I have a question, Madam Borough President.
Yes, please.
We have seniors in our district who financially can't afford tablets who don't live in NYCHA. Are there any plans to help those who are financially challenged in a deep way and can prove that they're challenged to acquire tablets because they are missing out on their senior center activities and all of these services you provide, as well as volunteer work that they do? Is there any
Yes.
way of gaining access to the tablets?
So thank you so much for your question. First, I'll talk about so you're familiar with NYCHA and our partnership with them around the 10,000 tablet distribution. We did prioritize NYCHA in this work. We've also distributed hundreds of tablets to the population of kinship caregivers, affectionately called grandparents raising their grandchildren. We're also working right now to roll out a small distribution to what we call foster grandparents, which are older adults who are volunteering in our intergenerational foster grandparent program with young kids. We are in conversations with other city partners to talk about how we can continue to develop this work. This is something, really appreciate your question. We continue to think about how to evolve this space, how to make information and classes more accessible, and how we could continue that work. You had named before, this is a really difficult fiscal environment. So, we don't have an immediate solution, but it's something we're thinking about with a lot of intention to figure out next steps around this. And I also want to name, as much as we think about and prioritizing addressing the digital divide, a lot of our providers and our direct staff have also been really creative around using the phone. And we're not just limited to these platforms. And I think we've also seen some really powerful work happen telephonically, including virtual universities that have really thoughtful content for older adults. But thank you for that. It is something that's definitely a priority for DFTA that we're working on.
Speaking of the digital divide, and that's one of the challenges of getting a full census count. Has the department been doing any census outreach to our older constituents?
Yes, thank you. Thank you for that question. I love these questions. These are topics that we feel super passionately about. So yes, we have done outreach in terms of reminders to our vast provider network and really asking them to encourage their clients to fill out the census. And we have a number of direct service areas, units that manage big caseloads directly, and they're calling their clients to do that final push. Appreciate that we're at the finish line, and we want to do whatever we can to support this really important work.
That's great to hear. Thank you for prioritizing that in your department. One of the things that occurred to me, and it was very acute during Tropical Storm Isaias, which was just a few weeks ago, was that seniors who are homebound, who live independently, it's a blessing to be able to live independently. Many of whom live alone, were particularly made vulnerable during the prolonged power outage. Or power outages. Queens was hit particularly hard compared to the rest of the city, Queens County. And, we were getting our constituent services were getting calls from people whose elder neighbors, after, they only have landlines. And with the power outage, there's no phone. And after a few days of no power, would risk themselves, risk exposure to COVID, step outside of their houses or their apartments to go next door to ask their neighbors for help. And their neighbor would call my office asking for help to reach Con Ed for these vulnerable populations. We are continuing our discussions with Con Ed as well as the other utilities. For example, PSE&G in the Rockaways, my chief of staff just testified at the city council hearing just yesterday afternoon about some of these issues. What occurred to us though was during a power outage, when we report as a customer, when we report that there's an outage, there's nothing in the outage report where you can check that you are a vulnerable of a vulnerable population. You know, if there's even a box in there that, you know, elements that, you know, you're above the age of X, or, you know, you live alone, or something where we can augment or highlight or elevate the priority level of particular vulnerable populations in prolonged power outages. Is that something that the agency discusses with the utilities? Because again, as we were acutely reminded of during the pandemic, power is an essential service. And when that essential service is cut, even with the act of God, but also failures on the part of a utility company to restore it with urgency and expediency, our elders are the ones, as well as folks who have health vulnerabilities, but our elders really are made vulnerable. And the uncertainty is also very anxiety provoking. And in light of the complexities of the pandemic, it's especially dangerous for them to seek physical help. Are these conversations that the agency is having with the utilities?
So I'll take that back. I'll tell you what we have been doing, and certainly we'll follow up on your utility specific question. We work very closely with the Office of Emergency Management to really get ahead of things like storms that we have some awareness are coming, and really think through how to plan. You're right. COVID has created unique complexities. A lot of what the city sort of typically does is some canvassing to actually knock on people's doors and make sure that they're safe. And some of that has to, has to be revisited in light of the COVID public health risks. What we do, we're certainly very aware, and the home-based services are under my domain. And when we talk about case management clients who, sometimes have significant issues with ADLs, IADLs, or in need of home care, have, mobility limitations that could potentially, these things are complicated. People can be in high rises and there can be disruptions to elevators and so on. So I think the most thoughtful thing that we do is really work with clients ahead of, more known emergencies like storms, to really talk to them, make sure that they have what they need. Should something go wrong, that they're prepared, that they have that emergency toolkit, that they're connected with support if that's needed. So there's a lot that we do every time that there's a potential for anything like this. We're always thinking about worst case scenario and trying to position our clients to be safe and to be, to have their needs met as fully as possible in these type of situations. And we'll definitely take back your utility comment. Thank you.
I appreciate that, especially we are still very much in hurricane season.
Yeah.
Utility companies have demonstrated their incompetence at customer service, to put it lightly. Any other questions from the cabinet? My last question for you, Ms. Groden, before we let you get on with your very busy day. Given the unique challenges of the pandemic, which is still underway, what do you see is the greatest challenge in the coming months for our seniors, for our elders, and how can we, the district managers, community boards, and local government better serve in light of the complexities of our new reality.
Thank you for that. What a thoughtful question. The three things that immediately come to my mind, recognizing no answer is fully complete, but is food insecurity, which, I think there's a lot of unknown. People are going out more now than certainly they were in April, and there've been a lot of thoughtful things and provisions put in, such as senior hours at grocery stores, which have increased safety. That said, when you look at the economy and the labor market and the overall climate, this is something that I think has a strong likelihood to prevail. And when we think about food, it's not only food insecurity, it's also, having food that's healthy and appropriate for older adults, that's ethnically appropriate, whether it's kosher or halal or vegetarian or whatever those particulars are. So really addressing that. And then our other huge item that certainly I would like people to think more and more about is social isolation, which the impact to your physical, mental health, even, the research is extraordinary when you look at things, even like impact to mortality, correlation with Alzheimer's disease. We really, as a city, I feel like there's not enough we could do. So DFTA is doing a lot, and in terms of 1.4 million calls, in terms of really shooting broadly around, social isolation could also mean intellectual and creative engagement, right? Creating a different menu of things and options that resonates for different type of people. I think as we continue to expand to make friendly visiting more accessible, it would be great to partner with you to look at recruiting more volunteers. We've been thinking a lot about peer-to-peer as an opportunity to address social isolation and have older adults supporting older adults, and what that can look like. And to think about it in different ways, and would love your thinking of partnership around this. And then, the final thing, which is definitely connected to social isolation, is what you named and asked about, which is really how do we create funding streams and opportunities to make technology, tablets, Wi-Fi, education, tech education, and help desk support more available to older adults. I do think as awful as this crisis has been, the opportunity here is so much around the tech space and the opportunity to really provide more choice and a holistic range of interesting supports and services to older adults to keep them safe and keep them engaged and connected.
Right. No questions from the cabinet? Yes. Debbie Markel Kleinert. I think you're still on mute, Debbie.
Hi, thank you very much for attending today. We really appreciate your presentation, and thank you, Madam Borough President, for hosting our cabinet as always. You mentioned social isolation, which is a very real issue for seniors, and depression, which is almost as bad as a pandemic and COVID. Do we have any idea when the senior centers are going to open and what they're going to look like? And maybe in that respect, when we come back at 25% or 50%, some of the seniors do need that interaction and do need to know, because they don't have anybody in their life. They have no more family. People have passed away. And their dynamic of their community life has changed. And it really creates a hardship. And it's almost as detrimental as a pandemic, depression and isolation. So is there any thought of when the senior centers are going to come back, and how it's going to look and what it's going to look like?
Yeah, thank you for that. And I want to recognize, of course, I'm definitely with you on the social isolation point. And I think your question really resonates. in that as much as we can do virtually, as much as we can do telephonically, I mean, there's nothing that fully replaces face-to-face. And also, you know, the familiarity and comfort of going back to your senior center with your friends, with your community, with staff that you've known for years and have strong connection with. So certainly we're as eager as you are to open. However, just like everybody else, we're really following the public health guidance and still figuring out as we work very closely with our providers, as we work very closely with the public health experts at DOHMH to figure out the path forward. And while we don't have an immediate plan, I think some of those attributes that you just named, you know, thinking about capacity and, you know, limiting density to really carry out those basic public health principles around social distancing, mask wearing, and so on. I think that's probably like generally the path that we would be looking at, although there's no immediate plans. And we're really eager, and we know that the older adults are really eager. Certainly, we've seen that through the cooling centers, that older adults really want to come out and see their friends and community members.
Thank you.
Yeah, thank you.
Great. Thank you, Ms. Groden, for joining us this morning at the Borough Cabinet. You are welcome to stay, but please don't feel obligated to. And thank you again for answering all of our questions and for all that you do for our seniors.
My pleasure. Thank you so much for this really important conversation and for keeping older adults top of mind. Thank you. Have a great day. Be safe.
You too.
Take care.
Up next, we have with us from the New York State Division of Housing and Community Renewal. Very timely guests today, especially in light of a number of rent regulations that were recently passed and signed into law by the governor. But as we know, the Division of Housing and Community Renewal is responsible for the supervision, the maintenance, the development of affordable low and moderate income housing. And it's housing and the affordability of it and the feasibility of it is a near daily concern for the city of New York, and certainly notwithstanding the borough of Queens. Today we have with us the Deputy Commissioner of the Office of Rent Administration, Woody Pascal. Welcome, Mr. Pascal. And I believe he is joined by Cheryl Bedard, counsel for the Office of Rent Administration. Welcome, Ms. Bedard. And so without further ado, Deputy Pascal, welcome to the Borough Cabinet.
Thank you very much, Madam Borough President. And I want to thank all of you for the services that you continue to provide our communities in these very difficult and challenging times. You folks are the folks that are on the ground, and you continue to advocate and ensure that we are safe and secure. And I just want to say thank you on behalf of Commissioner Ruth Ann Visnauskas and the Office of Rent Administration, which is centrally located at 9231 Union Hall Street in Jamaica. So again, I want to say good morning to everyone. My colleagues and I are very happy to be able to discuss with you the implementation of the Housing Stability and Tenant Protection Act. Now, I have a little slideshow, and I don't know if someone has to give me permission to get in.
Woody, you can, if you want to share your screen, you can share your screen.
Bingo. Okay, hold on. Am I sharing it?
Yes, you are.
Bingo. Great. Okay. All right. So our office, the Office of Rent Administration, regulates rent stabilized and rent controlled apartments and landlord-tenant relationships in privately owned buildings in New York City, Westchester, Nassau, and Rockland. We regulate over 46,000 buildings and about 1 million apartments. We require owners to file apartment registration forms with us every year so that we have a computer database with tenant names, addresses, rents, and lease information. Our office functions very much like a court, where tenants and owners file various applications with us on our forms and they attach evidence. We open something that we call a case, and then we serve the complainant on either the tenant or the owner. They provide us with responses, and there's what I call back and forth, so we can get evidence from both sides, and we issue something that's called an order. Tenants and owners then have a right to appeal anything that we do. So in that context, we're going to now talk about the overview of the Housing Stability Tenant Protection Act. So, historic changes that have not occurred since probably the enactment of rent regulation. So, with that being said, so vacancy longevity increases. So what I call in the old way, an apartment could be decontrolled if it hit a certain threshold in rent, or a tenant had a certain income level. And there was something called a longevity increase. Basically stayed there over 8 years. You got an instant bounce when the apartment became vacant. Ms. Bedard, what happened now?
Under the new law, the vacancy and longevity increases have been repealed.
Got it. Okay. Preferential rent. You can have a legal regulated rent. Well, let's say I'll use $1,000. Rent is $1,000. The owner says, you know what? I'm not going to be able to get $1,000. I'm going to charge you $800. You've got a lease. Your lease term is about to end. The owner says, you know what? You were paying the $800. You're a good tenant, but I need the extra money. I'm going to increase the rent to the $1,000 level. There was a lot of instability regarding people who had preferential rents. And just so you all know, it's about shade under 300,000 apartments that have preferential rents. So under the new law, you could jack up the rent up to the legal regulated rent. Under the new law, Ms. Bedard?
Under the new law, if you enter into your tenancy with a preferential rent, it remains for the amount of your tenancy.
And any and all increases are based on whatever the rent guideline board increases are set at. On major capital improvements, which deal specifically with new installations to the building, elevators, roofs, boilers. Under the old law, the rent increase was capped at 6%. Landlords could temporarily also receive something called a retroactivity increase to cover the period of the application date and the approval date. In addition, the MCI increase was based on actual verified costs. Under the new law?
Under the new law, the rent increase cap was reduced from 6% to 2% in New York City and 15% to 2% in the ETPA counties. The 2% cap applies prospectively, and it started September 1st of 2019 to all MCIs that became effective within the last 7 years. Additionally, the amortization formula changed from 12 to 12.5 over the amount of years, and the MCIs are no longer permanent. They have a burn off of about 30 years.
And increases also are not allowed where the apartment has hazardous or immediately hazardous violations under the Uniform Fire Prevention Code, Building Code, and the New York City Building and Housing Maintenance Code. On individual apartment improvements, which normally would happen when an apartment became vacant. An owner could spend $100,000 doing rehabilitation to an apartment. Under the old law, we would not really check it or pay much attention to it. In addition, it was difficult, we found, for the tenant to be able to fight and figure out how the increase occurred. Under the new law?
Under the new law, the IAIs are capped at $15,000 for an aggregate of 3 individual apartment improvements. They are no longer permanent. They have a burn off of about 30 years. The increases are not allowed, again, on apartments that have outstanding hazardous or immediate hazardous violations. And the costs have been substantially reduced to a reasonable measure. And also the agency now requires photographic documentation to be submitted into our repository so that we know exactly when the IAIs have occurred.
And what's interesting about this, upon a vacancy, the largest amount that an owner can actually get in terms of the increase under the new law is $89, like $89 and something cents. Is that
Yes.
correct? Oh,
Mhm.
got it. Okay. Now on rent control, there was this archaic formula that mostly seniors were impacted by. On an annual basis, their rents could go up as far as 7.5%. It was just awful and horrible. Landlords had to go through this process applying to us, but they would normally get it. Under the new law,
Under the new law, the maximum collectible rent increases will now be the average of 5 years of the most recent Rent Guideline Board's annual rent increases for one-year leases. And we have also had fuel pass-along charges repealed.
personal use and occupancy by the owner. Owner could basically say, I want this apartment, file an application, tenant potentially would be displaced. Under the new law,
Under the new law, owners only allowed one apartment, and if there is a term of period, if the tenant is 62 years of older and there's some other aggregate factors that go in, the landlord cannot get that apartment.
under the old law, there was a sunset period. It could be 4 years, 8 years. So there'd be all this, what I call anxiety for tenants who resided, of course, in New York City, Westchester, Rockland, and Nassau. Under the new law?
Under the new law, the clause has been established that the laws do not expire automatically.
Ms. Bedard, I'm gonna ask you to talk about the overcharge aspect of it, the look back.
Under the old law, prior to HITSPA, we had a 4-year look back period, and that 4 years was substantial from the date of the complaint. We would go back 4 years. Under the new law, it is set up that we have a term of 6 or more years with regards to how we can review an overcharge complaint. So what we're doing now is we're holding it at a baseline, and we're going to start from the 4 years, which is aggregate of a comparable amount of the old law. So we would go back, if someone was to file a complaint today, we would go back until June of 2015, which is 4 years from the date of the passage of the law, and we would work our way up. So if the complaint was filed today, September 15th, we would go back to June 2015, and then we would work our way up. Right now, we would look at a base date of about 5 years and 3 months. I know it sounds a little complicated, but it's the easiest way to make sure that we implement the law and we're protective of both tenants and owners.
Right. Under the new law, residents who have been in place for 15 years or are elderly or disabled have additional protections. The Housing Stability Tenant Protection Act has also changed some things for tenants. Security deposits are limited to 1 month. Protects the evictions based on tenant filing code violations. Extends eviction process to give tenants time to pay back rent or find a new place. I think that's kind of it. We continue to do outreach, update fact sheets, conduct meetings with our partners. We've issued an annual report, which will be every year, regarding what we're doing at the Office of Rent Administration. Ms. Bedard mentioned launching our individual apartment improvement central database. We are promulgating right now major capital improvements, reasonable cost schedule, and we are drafting regulations with the goal of the public to be involved in that process for probably, because of the pandemic, probably in January or so. So that's the end of my presentation. Thank you.
Deputy Pascal, Ms. Bedard, that was a very comprehensive but very easy to follow along presentation, so thank you very much. Any questions or comments from the Cabinet? I think Ms. Coloris has a question, but she's on
Madam
mute.
Borough President, I'm sorry. Can we
No,
get their information emailed to us if we'd like them to speak at our housing committees?
Absolutely.
Pascal, with your permission, yes.
Thank you.
And Deputy Pascal, if you don't mind, if you could also share with us your PowerPoint deck.
Absolutely.
That was a helpful breakdown.
Sure, absolutely.
And then we will share that accordingly with all the district managers.
Yep.
Any other questions from the district managers? Wonderful. Thank you, Deputy Pascal. Thank you, Ms.
Thank
Bedard.
you.
Again,
Appreciate you all.
for that
Thank you.
timely presentation and comprehensive presentation.
Thank you.
Thank
Be well, everyone. Be safe.
All right.
Actually, Gary Giordano of Community Board 5 has his hand raised.
Okay.
I'm sorry, Mr. Giordano, I missed you.
Okay, I don't blame you. We had a problem in Ridgewood with, I believe, most of it during renovations, people losing their apartments. And I'm wondering, I have two questions. One is, how many people do you believe became homeless because of the old laws with regard to apartment improvements? And my second question is, how many inspectors does DHCR have to go out and make sure that things are right in apartment buildings?
Okay. For your first question, individual apartment improvements are done in two ways. If you are a tenant in a building, you have to sign off on any improvement that the owner is doing, whether it is purchasing a new fridge or stove, electrical work. You as a tenant have a right to refuse that work to be done. On vacancy, when an apartment is empty and open, an owner can spend, well, under the old law, could spend whatever he or she wanted to increase the value of that unit. It's hard for me to gauge if people became homeless based on IAIs. I can tell you what the vacancy, I can tell you what apartments came out of the system based on a variety of measures, and I can get you those numbers separately. Now, regarding inspectors, DHCR currently has 11 inspectors, but we also don't do the same thing that the Department of Buildings and HPD does in terms of local law, in terms of housing maintenance and building code violations. Our inspectors specifically deal with complaints that are sent to us and do inspections of major capital improvements.
11 inspectors?
11.
For what geographic jurisdiction?
New York City, Westchester, Rockland, Nassau County.
It sounds crazy. It
We
sounds ridiculous.
we were actually in the process of hiring an additional 90 plus employees, but the pandemic hit, so we've kind of slowed down that process. We actually hired about 80 people since April of 2019.
So, all right, let me ask you a question, not to belabor the point, but some of the reading that I've done, and I'm not sure if this is in all instances, that under the old law, that if someone's apartment was renovated while they were living in it, right? You could renovate somebody's kitchen and other areas of the apartment, and they could be living with someone else, or they can just, leave the apartment for the day while that work is taking place. You could do a lot of renovations. So it's not that difficult to spend $40,000 to renovate an apartment. Well, my understanding was that in a lot of cases that you could get your money back as a landlord in 40 months. So I'm a believer that at least in Ridgewood, where part of the area, the most important area, in my opinion, that I cover in District 5 Queens, that a lot of people's rent went from $1,200 to $2,200 if their apartment was renovated and they didn't realize that the landlord could get the money back that quickly.
I would say, again, if a tenant allow the owner to do major capital improvements. In this case, what you're saying is that there was major work being done while the tenant was still in occupancy. The
Correct.
tenant would have had to sign off on that.
Right, but could the landlord get the money back that quickly?
It would depend on what he or she was spending.
Well, they renovated the apartment and they spent 40 grand.
Sherelle, what was the amortization for the old law was what? On an MCI? Sherelle? Oh, she's not even on the phone. Oh, she probably jumped off already. I'd have to get the numbers. I have to look at the amortization numbers.
Yeah, I would appreciate that.
Okay, I can get that for you.
I have a question.
Yes.
I just wanted to know, before the tenant signs off on the work,
Mm-hmm.
does the landlord have to inform the tenant how much, at least an approximate price or cost for that work?
Yes, and that's actually part of the new law too. So there's actually a form that's on our website that the owner has to give to the tenant to say what the work, the scope of the work, and how much they're going to spend and what the rent increase is going to be. And that's actually in the top 7 languages. I can send that to you all also.
Great, thank you.
You're welcome.
Deputy Pascal, thank you again.
You're welcome.
Again, thank you for your thoughtful answers and for any follow-up from this meeting. Thank you.
Anytime.
Welcome back, Ms. Bedard. And we hope you have a safe day. And thank you for all that you do for Queens.
Appreciate you all. Thank you.
Thank
Have a great
you.
day.
All right.
With that concludes the items on our agenda for this meeting of the Borough Cabinet. Our next meeting will be Tuesday, October 20 at 9:30 a.m. I see Frank Galuccio has a question. I see his actual hand. And forgive me, I don't see the emoji hand. So we'll get that glitch cleared out for future meetings. Mr. Galuccio, you'll unmute yourself and you had something.
Hi, good morning. Thank you again for all you do, Sharon. We really do appreciate it. Quick question for maybe one of our next meetings coming up with our cabinet. If you could request, whoever takes care of that we have someone from the DOE come and speak to us, the district managers, with regard to everything that's going on, particularly with the pandemic, et cetera. The changes, everybody reads newspapers, everybody sees the news. But I'd like to know what's going on specifically in my district. I'm sure everybody else wants to see that in their district also. And a big part of that, say, for example, would be, I know it's not the DOE's parameter, but what happened with the school safety guards and what happened with our crossing guards? Those are really important questions. I don't want to focus that when we meet with the DOE later on in October. I think they should, I know they have their hands full opening up school, getting all their protocols down. But if we could, at one point in if not October, November even, I would love to hear, I'm sure my colleagues would also, just to see an update on the real latest facts that are going on. Not to grill them, but to hear from them all that information. I think that would be really, really important. Excuse my glasses. Please.
I think that's a great idea, and I see a lot of head nods around in the room, and so we will certainly try to get them either to the next cabinet meeting. We do have a parent advisory board meeting scheduled. Well, it was supposed to be September 24, but that was before the school start date was pushed to the 21st. So we might push it over to the 29th or the 30th or the 31st, 30th of September. But we'll certainly invite them and try to get them in front of the cabinet sometime in the next couple of weeks. And I completely agree.
Madam President, even if we can get Monica to be there with us, because she's our go-to person, kind that would be helpful. Except I know they do the parent advisory thing, but just for our information when the parents come in.
Yeah, and the nature of the parent advisory board conversations is very different from what I imagine that you would want to ask.
Yes.
As you said, less grilling, more facts as well. And I appreciate that. And actually, just a quick reminder, if you haven't heard, we had several vacancies across a couple of community education councils. As you know, I have 2 appointees on each of those councils. I completed those appointments, and so we have all 14 of my appointees are active on the Queens Community Education Councils. So we'll be leaning on. We wanted to make sure that that was done before the school year, and that is now whole.
That's very good.
But yes, thank you for the suggestion, and we will make that happen.
Thank you. Have a nice day.
Anything else? All right. Stay safe. Be well. See you soon.
Bye,
Bye-bye.
everyone.
Bye.
Bye.